Today, we're getting under the hood with Magaly Pirotte, a daughter, sister, friend, women's advocate, and independent researcher on sexuality, education, and sexual and reproductive health and rights. Over the past 20 years, she has been active in the defense of sexual health and rights as an activist and as an employee in nonprofit organizations. She founded Sex Ed Plus, where she creates pedagogical supports that represent the diversity of genital anatomies. She expects this will contribute to improved medical and psychosocial training and interventions, and ultimately contribute to a better sexual health for all. Magaly also advocates for a sexuality education that is more inclusive of the diversity of bodies, identities, and experiences, and centered around anti-oppressive practices. Welcome, Magaly.
Hi, good afternoon.
Oh, I'm so excited to be getting under the hood with you today because you have a really interesting story. I mean, it's season 3, Women Making the World Healthier, and you're doing a lot around sexual health. So if it's okay, I'd love to get going.
Yes, sure. So I have been working quite a lot around reproductive and sexual health issues. So it is my field of expertise, even if I didn't go to school in this field, but it sometimes happen in life. And so I was pretty aware of like the issue that we've got in terms of like what is the data, what is the research, what we are lacking, like the trouble with obtaining services of quality for certain population that do not have the same quality of care. So I was pretty aware of all of that. Also aware of that we needed to be better at what we were doing because there are a lot of issues that are really literally affecting people's health and sexual health. And so I was with all of this luggage of knowledge. And at some point in 2016, a French researcher made available the first 3D print of a clitoris. And obviously, I was extremely excited. I had never seen it before. It didn't existed. So I went with friends to 3D print it at the Fab Lab. And I used it in a lot of contexts, like showing it around and talking about it. And it totally changed the way of talking about sexuality and sexual interaction. Because when you have a clitoris as a pedagogical support, you do not have the same discussions that when you have a drawing of the reproductive organs of male and female bodies. We don't talk about the same things. We don't have the same questions. So it opened a whole world of possibility, and it was amazing. So I didn't know anything about 3D printing. I come from social science. So I went in the database and I looked and I was like, oh, do we have genitals? Do we have contraceptive methods? Like, what can we print to make better our practices as sex educators? And there was nothing. There was sex toys. There was like a very creepy 3D made vulva that didn't resemble anything close to a vulva. And so I was really upset because I was like, we have like a great potential with 3D printing and nothing exists. So as usual, like you're like, oh, there is something that needs to be done. And you're looking around and it's like, oh, it needs to be done. Who is doing it? You wait. No one is doing it. After a while, you be like, I will try to do something. And so it started like very small. I never planned for this to become my job. Like I had a full-time job. And I just started tinkering with the 3D printed clitoris because I broke it so many times. I was always putting it in between my legs to show people how it was sitting in a female body. And it was breaking because it's plastic and it's pretty thin. And so I was like, I'm going to try to make a soft version. So I tinkered, I learned about silicone and I played around and I ended up having like a pretty convincing soft clitoris thingy. And I was going to France. And so I contacted the person in France who created the clitoris, being like, hey, I've worked on your thing because that way it's not breaking. We should meet. It should be nice. Let's get a coffee. And she was like, you know what? I'm going to the hospital to meet some people who are working on genital mutilation. and you should come along. And so I came along, met some people, showed them the clitoris, and they were like, this is interesting. What would be really interesting is to have a vulva with the clitoris that you can insert and remove, because sometimes it is difficult. People do not understand the anatomy, what has been cut, what has not been cut, what remains. And I was like, yeah, why not? Let's try it. So it started like this. Like I was living in a one bedroom apartment, really small with a cat, and I started on my kitchen table. And because I knew people, they were like, oh, it's interesting. And it started like, oh, it would be nice if we could have this model and this model. And oh, I would really need this for my work. And so sex ed started like a bit by accident. And because I have been doing this job for quite a while, like I had kind of a reputation of someone already working in the field. So when I started to recruit model, because of all the models that I create are molded on real humans, like alive, very happy and very respected human. And so when I started being like, oh, I'm looking for humans to basically go get naked in my house so I can mold their genitals, like people kind of knew that it wasn't some creepy kind of kink. And it was like really inside of a project which is based on consent and providing better um, sexual health material, like to better train physician, to have like, yeah, just to have better material.
That's amazing. First of all, thank you so much for sharing that. And I really appreciate the work you're doing because you're right. By creating that, that opens a whole new world and a whole new conversation. So that's amazing. What I'm sitting with here is like, what was that inflection moment that got you on that journey? I mean, you've been a researcher your life, right? So talk a little bit about your earlier years to coming into this. Because yes, I can see your company actually unfolding in sort of a surprising way. But what got you to where you are is based on doing a lot of work and being curious. So can you share that with everyone, Magaly?
If you want to know all the job I've been doing in my life, like we are not done yet because I've been traveling around. Been doing every kind of things from catering to doing animal heads in felt. So I mean, I'm immense, but like I've been mostly working like in like my more traditional job with non-profit group that are defending rights that are not respected, like in different contexts, whether it is sexual rights, economic rights, like anti-racist projects. So I always had this lens about like a lot of people are not included in conversation, in care, like a lot of people are put in the margins because of their identities, experience, bodies. And so that was one part. On the other part, I've always been a bit of a nerd, and like parallel to my job, I was always trying to have a foot in research, like academic research. I come from social science, so it was always going around like history of feminism, of women's rights, of reproductive rights movement. I worked a lot on reproductive justice also. And because it was a concept, like I live in Quebec and I speak French, like as you can obviously notice. And so when the reproductive justice movement theorized all the concept and stuff, it was amazing, but it was in English, so very inaccessible for French-speaking population. So I worked a lot on translating in French and adapting and making it understandable for people. So I had all of this. And because I've done like a million things and I love to do stuff with my hands and like learn new things, whether it is like leather sewing or like whatever it is, gardening or, it was just like the precise moment was really the day I went to print the 3D clitoris and realized like there is something to be done. And I had like a network, a bit of a political understanding of what happens in society, like based on research, like not out of the blue. And I had like a very strong, like I think the strongest desire I had was to be impactful, because I think we all had in our job like the feeling at some point that we were not going as fast as we would love to. And I was nearing my 40s, and at some point, I don't know, when girls get like a bit overactive and be like, I want to make an impact and I want to really choose what I work on and choose who I am working with and who I collaborate with, because in our jobs, like sometimes we don't decide who we collaborate with. And so I kind of was having a big desire for freedom, creativity, and impact. And I was ready to do the sacrifice and slash fun to get there, because I come from the nonprofit sectors, which means I don't have money. I rent, I cycle, even in the snow. Like I'm basically not rich. And like embarking on this type of adventure, coming from nonprofit, it means I didn't have any backup as money. Like I have to pay rent every month. And so from the beginning, I was like, I'm going to devote all of myself into this project to put it into existence. But my condition is that I will never take a loan, because however it works, I want to be able to pull the plug from one day to the other and find a job wherever so I can pay my rent, because I have no one to back me up in case. So it was my safety zone. So I did a lot of not being paid, like really not having money, and like, scrounging for breadcrumbs and like little jobs here and there to make ends meet at the beginning. And I was really lucky. It was at a convergence of events, and I actually can pay myself now with the project. But it's like I'm still cycling even in winter.
Thank you for sharing that. And congratulations to you. I mean, these labors of love, I love the fact that you said you were nearing 40 and you had this moment and you wanted to make a greater impact. And so you were willing to take the risk and do what it took to, and in a way, kind of coming out of nonprofit, you kind of knew how to live in a certain way to be able to do this. So good for you and good on you and good for the world to have the work you're doing. I think it's really interesting, though. What I'm hearing across the board from you, Magaly, is this activism in you. What you were describing a few minutes ago was the fact that women's rights, human rights, all these things, economic rights, looking at, people living on the margins and how you could affect them. And so bringing that into the sexual health world, I think, is really interesting. So share, so here you're doing this work. Like, what are the types of research separate of like building out your 3D anatomy and stuff? Share with the audience the actual, like the way you're using this work to support and educate, women and people around sexual health.
Okay, I think we have a barrier language, so I'm not sure I understood your question well, but I will try. And if I'm off track, please put me back center.
Okay.
So, like, I think being political, like if you know me, you know that it is like a big part of my life. I think what you could center it in like two concordant emotion, which is rage and love. Like I'm enraged every bloody day I wake up because of the world and what happens in it, and the little care that we put into supporting people so they can thrive. And the love is that I really love people. I despise a lot of systems that happen, but I really love people. And I think with more, like, the people deserve to be heard, like their suffering, their pain needs to be heard, their strength need to be recognized. And there is, especially in sexual health, and medicine in general, there is very little space for that. It's a field that is extremely centered around like some it's like a male-dominated science, even if it's changing, it's the way it has been created. And like for the longest time, like the voices and experiences and reality of people who are not male and white have just been unheard. And this has some extremely dire consequences. Like I do not work with people. I work alone in my cave, in my basement. It sounds creepy, but it's a fact. But every people I talk to, I've had an experience of like being not feeling good during an exam, not being heard about their pain, like sometimes being in medical limbo for like 10 or 15 years for diseases as not so difficult to understand than endometriosis, but no one cared. And so you have like people who cannot work like a 9 to 5 job because 1 week of the month they are unable to work and they're in pain. And if you add to that like the rape culture and like the non-consensual like medical exam that can happen and like the not taking in consideration the pain during the exam, whether, and I'm not just talking about women, it's like it goes also for racialized folks and all the stereotype, it goes for trans folks. Their bodies are unknown to most physicians. And so when they are looking for care, like they most of the time don't have the proper care if it's not related to their trans-affirming care. And let's not talk about intersex folks who are like mutilated and operated upon. So there are a lot of people who are like suffering and in pain and in rage. And there is no reason whatsoever that these people shouldn't have access to information that are relevant to their body, to the type of sex that they engage in, to their pain, to their health, while some other like have more access to that. And yeah, so I don't know if I was center of center, but it is what I'm bringing
I
now.
actually know, I love that answer because it really makes way for the next question, which is, so you've created your company, the Sex Ed Plus company. Can you share with the audience like what your offering is, what the entails, and maybe a little bit of your journey to building it?
Yeah, sure. So what I'm offering, it is extremely simple and not revolutionary, and this is what is enraging. I am reproducing genitals on people, every type of genitals. I've molded people who are cisgender, transgender, non-binary, who have had surgery, some voluntary, some coerced. Like I've molded every type of bodies. So I'm basically creating a database of genitals. And you're like, hey, why? Because body molding, there is nothing new. We have been doing that for centuries, literally. So I am not inventing anything. And you have some artists who actually have been already casting genitals on people. So it is not new, but it has never been done with the explicit intent to create material to train physicians. And I don't know if you or someone in your audience has ever gone to a sim center, like where they actually train physicians and nurses. So they will have like full body mannequins and blah, blah, and it is absolutely amazing. They can give birth. They have veins, like you can practice your medical exam on them. It's really amazing, except when you arrive at the genitals. When you arrive at the genitals, it Ken and Barbie lands. It's like it doesn't look like anything, which means that we are training future nurses, physicians, etc. With like the last time that I've read the research about it, they were saying that in North America, half of the doctors will not have had any form of sexual health training during their doctor's training. And for the other half who had, they had an average of 8 hours during their whole medical training. That leaves very little to address all the issue about menopause, about pain, about autoimmune disease that will affect the genitals, about like basically your doctor is not trained on sexual health unless he or she like really put their heart into it and took additional training and trained themselves. And so this leads to gynecologists being totally inadequate when they examine you. Like my
Mm.
dentist, when I went to her and told her the job I was saying, was like, oh yeah, my first gynecological exam, I was there with my legs spread and I was a really young woman. And the doctor was like, it doesn't look really nice. You should be operated to make it nicer. No one is going to want to be with you. I was like, what is this? Like, no one has asked your opinion. And what is it based upon? Like, how many genitals have you seen? Do you know what genitals look like? And so, yeah, it's not revolutionary, but there was a gap of bringing this knowledge, and especially the body that are less traditional. For example, bodies who have had certain type of disease, like how will you be able to recognize vulvar lichen sclerosis on a patient if you have never seen what it looks like? So people get undiagnosed for like 10 years, 20 years. So by providing these models, like I do expect that, and it's not I do expect, like we've actually tried, it's been a couple of years, and I'm partnering with many university that who are having actually like the models and using them with their students. And in a diversity of contexts, it's not just for training doctors. It can be in Planned Parenthood. It can be in a trans affirming clinics. Like, because if you're trans and you consider like having a surgery done to you, it's really important that you know what to expect from the surgery and where are you going to find your answer. If you know other people in the community, they've got blogs where they put picture. But if you're not familiar, if you live like not in a big city and don't know other trans folk, like there is just porn basically. But you don't go to porn to make a medical decision about your body. It doesn't make sense. So the idea was really to have a database, to have material that can be used by everyone who needs it. I never recommend people. Sometimes I like, oh, what do you recommend the context to use it? I'm like, I work alone in my basement. I do not recommend anything. I create things and people who need them will know they need them. And people who are not comfortable with them should not use them because they would not be comfortable. So nothing good would come out of it. So, yeah.
Well, thank you for sharing that. I love the way you just put that. But I mean, I think you did create the company to educate people and to make people more aware of their anatomy. And I think it's amazing because if it doesn't exist, and I was going to ask you, so you're in universities, are you primarily in Canada? Like where is sex ed plus sort of, where's your dominant market?
Or worldwide. Yeah, it's really worldwide. Like I mostly collaborate with people in Europe, in the Francophone Europe and United States because of the proximity. And but they are also in Australia, and we are not many people in the world like being passionate about genital anatomies. Well, maybe like, I don't know, 20, 30, if we really stretch it. So we know one another. Like this
Beautiful.
weekend, I was with a French researcher on the clitoris who was visiting in Canada. Like another from Geneva is coming next week. Like we know each other, we work together. We even have a group that we call the International Clitorati Group, where we have people from everywhere and Australia, because we are so few people working on that, and there is so few resources allocated to that, because you have to know that my project has no funding whatsoever. Like the money I make is only from the sale. And a lot of other projects are like that. And so some couldn't even survive because without funding after a while, like how can you cope? So it's really important that we are networking with one another to be like not duplicating research. And like if like let's say if I have to develop like a new model, I am not deciding what to develop. Like I go to conferences, I talk to people, and people will come to me and be like, you know what, I have noticed that we are really needing to have this and this done, and we will collaborate. And I will, I went to Belgium to mold people, and like we developed like materials together. So it's really a work of collaboration. Like I am not the lone genius in a basement, like revolutionating anything. I'm just the one who put the ends into projects that were needed by like people in the community. So it's really like a matter of being impactful in your community of practice, and try to do the best with what we have and like hope for the best.
I think that's incredible. And I think what's really interesting, just having been on your site and looking at the models and stuff, like, are you going out, Magaly, and are you doing any teaching as well? Do you go out into communities beyond, or are you just building the product that helps educators educate in the system?
Yeah, it's the later because always we are getting coming back to impact, and there are a lot of people who are doing like talk, going into classes, going into training. And so sometimes if you catch me when I'm like in a hyperactive mood and you ask me to do something, I will be, yes, it's gonna be super cool, and I will do it. But I'm already working more than a normal sane, healthy human being should be working with that. And so I'm trying to not, there are a lot of people who do it really well, but I also like just with the project, the way I speak about it, like when I'm in the media or I go to a lot of conferences, like I really work with professional, not with the public. And so there is a lot of back and forth and knowledge transfer that happens, but really it's through the project and the way I talk about it that most happen. But like every conference that happens, I will have a table and I will have all my genitals and I will speak to basically everyone in the conference, because if sex ed has a table, everyone will stop by because it's really fun. It's like bright colored and it's like super fun. Like the idea was to make something like, it's not like the drab medical model that is beige. It's like, let's be funky, let's have fun, like sex, genitals, everything like shouldn't be like this big hush thing that we make it. Like, and it is actually amazing. Like a few times I have been to event like community event that were not for professionals, like, you know, queer things. And I was like, oh, it's fun. I'm going to be there. I'm going to bring my models. And like for people, it's like so, sometimes it's like so emotional to be exposed to real genitals and to be able to visualize themselves in relation to other bodies. And like I had people like crying at my table because it was the first time they could see. And some of them had this huge weight on their shoulders about thinking that something was abnormal, gross, not pretty about their bodies, and realizing suddenly that it is so diverse that there is no normal, there is no pretty, and genitals should just basically be about fun, being safe and being fun and having fun and pleasure, whether it's with yourself or with other people, and whether it's like nothing at all, but it shouldn't hurt. And if you use it, it should be fun. And so it's, yeah, that's why also the bright colors and stuff, and also to avoid all the racist assumption about genitals, because yeah, we know.
Well, you created pop genital art, but I mean, in a wonderful way, you've basically taken stigma out of it by doing that and making it friendly and fun, to your point. I think that's really awesome. So you've been doing this since, like, how long has your journey been when you started the company, and where do you imagine yourself going with the company?
Okay, so I think I started like the whole process, like the beginning of everything in 2018. In the middle of it, we had a pandemic, as you may remember. And it was really funny, hashtag not so much, that I started paying myself my first wage on January 2020. It was like a very small wage, but it was, I had enough for a wage. And in March 2020, like everywhere in the world, the schools and the hospital closed, and they were basically my main buyers. So we were lucky in Canada to have a relief for people losing their job, because I had like 2 months of salary and after nothing for quite a while, but the government stepped in. And after that, like it went okay. And it has been my full-time job ever since. Where I see myself is I see myself getting out of the basement and actually letting Set Plus go, because the goal since the beginning has never been to be a company, which is why I'm still working on my own. Like I could have expanded, I could have them manufactured in China. I could have inundated the market. It was never what I was aspiring to do. Like from the beginning, the idea has been to create an online database, like an encyclopedia online, where you can access all the models for free and you can 3D print them. Because the product that I make them in Montreal by hand. Obviously, they are expensive, and a lot of people in a lot of countries or contexts, they cannot afford that. And science shouldn't be accessible only to those who live in privileged countries. It should be accessible to all, wherever you live. So basically, all the extra money that I made by selling the material, I invested in the database. And my goal would be really that in 2 years, like the project will be available for everyone, and I could be on another journey and get out of my basement and have a bit of sun. But for this, I've realized politically that I want to get some money for it, because this project started with crowdfunding from the community. Like I did a $5,000 crowdfunding to buy my first batch of silicone. And it was member of the community thinking it is really interesting and it's really needed. And they were buying little bandanas and little t-shirts and little buttons, giving a 20 and a tenner and something. And so the project has emerged and has been supported by the community, but the project is mostly used by university, hospital, professionals, people who are basically doing 5 to 10 times my salary. And after a while, I was like, I want this project to be free and accessible to all, but I do not want to be the one carrying the financial responsibility, because up to now I put 120,000 in the database. It's a lot. It was basically a deposit for a house that I could have put there. But it's not my money, it's the sex ed money from the sale. And so I was like, to make the database available, I'm going to be looking for 200,000 grants or donation or whatever, but from people who are going to beneficiate from having this thing. So it is political more than financial. It's like making a point. Like there is no reason I give it to you for free. And yeah, 200,000 for a lot of people is not much.
I don't think you should give it away for free. I mean, you came up with this idea, you saw this unmet need, you went out and you built a solution to help educate people, and there should be, you should get compensated for that. So I don't think that's political. I think that's just smart business. I mean, we're not, it was your idea, you saw an opportunity. And I think it's a really interesting what you learned with that 3D printing and then going soft with the silicone and really, looking at it from, just how it feels, because that gets into something that's much more visceral. And that's sort of our whole genital anatomy is all a visceral kind of experience. So I think that's really interesting.
Yeah, and there is an inclusivity and accessibility idea to it, because my material is also available for people with disability, especially people who are blind or visually impaired. And so the material that is used is made to replicate human flesh. So for example, if you touch a penis in its erect and flaccid state, they are not going to be the same geometry for people who are learning by tactile, who are touching it. So, there is always this idea of access, like at every step of the project, whether it is financial accessibility with the sliding scale, whether it's like making it available, the color that I use, like for some population, they will request specific colors because it makes sense. Like if you work with people who are on the autism spectrum or with the developmental disability, it's really important that the colors are realistic. Like blue is not going to cut it at all with this population. And also for people who work in anti-racist settings, like how many times do you see a black, brown body represented? So for some people who work in these settings, like I will do realistic skin colors. For other people, I won't, because most of them won't know how to address racism when it pops in the classroom or everywhere. So let's not get there. Like there is already enough damage done around bodies. I do not want to add as much as possible. I'm not perfect. I'm making a lot of mistakes. I'm learning from a lot of people. But like when you identify a mistake and a possible tumble, like please, let's not go there.
Well, that's wonderful, and thank you for sharing that. I think that's really interesting, how you address, and I like the fact that you put that multi-prong approach to accessibility, that it's making it accessible on many different levels. And I think, I would almost argue that by starting by creating the product in the beginning, you're making it accessible to people, and then adding the sliding scales, the making it accessible to people who are disabled, I think is just wonderful. So as you continue, it's like, I'm kind of curious. So you see yourself in a couple of years, maybe doing on another journey out of maybe this home. Are you still thinking activism? Are you still in that world? Are you in the sexual health world? Are you imagining yourself in a different capacity? Because it's almost like in a way you've been kind of an artist, a creator.
I wouldn't claim artistry at all. Craftsmanship, definitely, but not artistry. But we can argue about that. I really have no idea, to be honest. Like, I think when I finish, like, the reason I also want to finish Sex Ed is I'm 45 right now, and carrying alone such a big project, like, I'm gonna get tired. And as many humans, I aspire to have paid holidays and an insurance for my health, because I also have health issue and I would love them to be taken care of by a future employer. But one can only hope. And I think I'm going to have to stop sex ed and take a few months to clear my mind, because right now the future doesn't look like anything. Basically, my nose is like on the ground every day, like trying to cope with everything. And like, I don't see the horizon. But it will also be extremely difficult for me to find a job, because I have been qualified in a domain for 20 years, but my diplomas are not on this field. So let's say if I was to teach at university, I could never have. But in the same time, I do not feel like going to do a PhD. I already have 2 masters. And going to do a PhD at 45, it's amazing for people who do it, but like I no. So what I would really like we've talked with some university, and what would really be nice is that Sex Ed Plus at some point is recognized as a project that has been contributing to science enough that I can have an honorific PhD out of it. So I could eventually pursue like a career in something, because like I'm at a level of expertise, like going back to an entry job in a place would maybe feel a bit constricted considering the freedom that I've had the last few years. So I really don't know. But probably if they keep doing Lord of the Ring series and movies, like my total dream would be to be walking silicon to do the orc masks,
Mm.
because this will be amazing. And I know how to walk silicon, so why not?
I know. I mean, it sounds like you're the queen. That's awesome. And I think that it's Magaly, like putting your nose down to the grindstone and being so caught up in what you're doing that you can't see. Sometimes that's a really good thing. It's like you've planted these seeds and now you're just continuing to water them and grow them and fertilize them. And sometimes that's exactly where you need to be. And that's
Yeah, but you
where,
need to know that it will stop,
yes.
because this is not a healthy way to function. Like, and it has got impact in personal life, in relationship, in everything. And when people contact me and are like, oh, it's amazing, and I would like to do something like you, I'm like, I salute your willingness, but I'm always telling them what it costed me. And I'm like, you need to get into this with your eyes wide open. And I'm totally against oh, she single-handedly changed something, and kind of, the creative genius who like made it all from nothing. It's like, this is not true. Like, and it comes with a cost, but it also comes with privileges. Like, and it's because I had some privileges that I could embark on this path. It's because I do not have children that are dependent upon my income that I could do that. But it also meant that I had to decide at some point that I would take the path of sex ed instead of taking the path of family, because the two could not be led at the same time. So there is no like all glory, rosy way of doing things. Life is always you compromise. And the only reason I can still do it 7 years later, like with my nose to the ground, it's because I know I am pulling the plug in the next 2 years.
Mm,
Because if I knew that my life was going to be this until like time comes, like I would feel miserable.
well, I
So
think,
it's the idea of contributing. Like I think I've done my part. I want to go to the end of what I promised myself I deem necessary. And after it will be like whomever wants to embark, take it from where it is. Like please do. But me, I'm gonna take a pretty quiet, paid holidays kind of job, if
yeah.
possible.
Yeah. And I think that the journey of an entrepreneur, being one myself, a lot of what you said resonates. Everything does come at a cost. We make choices to go down certain paths. And at the time, we could be very sustaining that level of passion and discipline to keep it going for so long is a lot. So I hear you. I think that it's incredible what you've accomplished to date. I think it's also amazing that you know what, there's an end date. It's finite, and that you can channel this energy into that point, to get over and go into this next transition of your life. I mean, this has been a very interesting conversation, talking about sexual health and the anatomy and the craft in which you do. I'm kind of curious, like, is there anything last before I ask the last question of our interview? Is there anything else you want to share, Magaly, about what you've been doing?
Hmm. There is nothing that comes to mind. Please go with your question. Maybe something will come up.
Well, I think it's interesting, women hearing this, but this is your platform today to give a message to women all around the world, of all ages, of all backgrounds, of all cultures. What do you want to share with them, Magaly?
I think that we should all, like, our bodies are weird and marvelous and a pain in the butt. Like, I live with chronic pain, and a lot of us do. And, like, we know that, and we go through changes and menopause, pregnancy, name it, name it. And, like, also including, like, folks who are not cis women. And, like we go through a lot, and in plus there is a lot in life, but sex, whatever your definition of sex or with whom you're having it or not having it should be a place to be fun and safe and pleasurable. And like, I don't know who's saying that, but pleasure is the measure. Like it eludes me who, Emily Nagoski probably. And, and yeah, it should be this place that feels safe and good. And whether it is like for sex, but sex is like so much more than just bodies getting together. It should feel the same when you go to the doctor, when your concerns are taken care of. And I just wish that we live in a place where people could live their sexual life like freely, safely, in a fun way, and that sexual health could be like carried around like with love and care for people who should be doing it and who are most of the time not doing it. So yeah, it's like let's put love into it. Like our bodies need love, our genitals need love, and love always starts with like knowledge and intimacy. And so we should talk about it, we should name it, we should stop like being censored all over the place by all the platform. Like I'm always in the red zone with Instagram. They've banned me a million times. It's like I basically do silicone thingies that are bright green. And like I shouldn't have to hide. Even LinkedIn actually kicked me out at some point. And it's like there is nothing to be ashamed. There is nothing pornographic about what I do. And at the beginning, it was one of the biggest issue that I've had with the project, to have people realize that you can talk about genitals and it is scientific and it's not sexual and there is nothing creepy around it. And I didn't understand because for me it was taken for granted. I come from this field of practice. I talk about sex for work. And at some point at the beginning of the project, a journalist, she was finishing the interview and I could see she had something burning her lips. And I was like, okay, just ask your question. What's burning on your lips and that you don't dare to ask? And she was like, but you have sex with your model. I was like, oh my God, I'm so glad you asked. If it's what you have been thinking all along in the interview, probably a lot of the people are thinking that. And no, I'm always making a point to say, I am never seeing my models naked. I'm not even touching them. I've developed a way for them to mold themselves while I'm in the room and explain them how to do it. But because I have erect penises, like people would wonder. And I was like, oh my God, I must have like 50 or 60 models. I would have been really active. I have no time to be this sexually active while carrying sex and plus. So none of my models I have been intimate with. I have not seen them naked. And if the penis is erect, it's because people are coming with their partner or partners, if there are several. And we will do the flaccid penis together. And after I will go and do crossword at the cafe and they will do whatever, I don't know, but they will take the imprint for me with their partners. So we are making that clear. This project is about consent and it's about respect. And I could be like opening the legs of people and going to put like pinkish goo on their genitals. I could be doing it and they would probably be okay. But because it is not necessary, why would I? Like we are so many times disempowered with our bodies, like when it comes to our genitals, like the gynecological exam and everything. Like, hey, for once, you are in charge, you're doing it. And this has had a tremendous impact when I was working with people who have trauma around their body, people who have been cut, who have been mutilated. It was the first time they were in charge of a process. And some of them told me, and I was crying so much 1 year later when I've seen them, they were like, for me, it was a reparation because for the whole time, in the first time in my life, I was in charge of the process and I could say no at every time. And I was lovingly accompanied in the process at my own pace and in charge of the result. And I was like, oh my God, you make my day. It's like, I know why I wake up in the morning when people tell me that, even if I had this impact with just one person in 7 years, I mean, I'm done. It's beautiful.
Yeah, that's wonderful. Wow, that's such an interesting and rich ending and call to action for all of us to love our bodies and love our parts and everything. And so, Magaly, thank you so much for getting under the hood with me, for sharing your experience, and I applaud all the work you're doing. Keep educating all of us about our bodies and about our sexual health and the importance of it. And I love the consent, safe and consent and pleasurable. Thank you.
Thank you so much.
Thanks for listening to Under the Sisterhood. If you haven't already, please give us a quick rating and review on Apple or Spotify. And make sure to follow us on Instagram, Facebook, YouTube, and LinkedIn so you can hear from more amazing women. This podcast is created and hosted by Under the Sisterhood LLC and Elizabeth Elfenbein, produced by Elizabeth Elfenbein and Matt Butler, and edited by Matt Butler. The music is by Ayla Schaefer. Her song, Rose.